welcome back to my channel. So today we are going to understand concepts part 2. Those who have not watched my previous video, please go and watch that video before we start. So today's topic are sensitivity, specificity, precision, accuracy, etc. So let's start with our first topic, that is sensitivity of a lab test. So what is sensitivity? It is the capacity of a test to identify all individuals with disease. Means individuals which are having disease, the capacity of a test to identify those individuals. So from your PSM subject, you remember that this is the 2 by 2 box in which these are the disease positive people and these are disease negative people, and on this side we have test positive and test negative. So this square is for true positive, this is for false positive, and this is for false negative, and this is for true negative. So all of you know that sensitivity formula is true positive by true positive plus false negative. Means total positive cases divided by total disease positive. We can write also sensitivity is equal to TP by disease positive individuals. Now let's come to specificity. The specificity is the effectiveness of a test to correctly identify without the disease. Means individuals which do not have disease, the test identifies those individuals. Now from the above table, we conclude that specificity is equal to true negative by true negative plus false positive. Means true negative divided by disease negative. This is our specificity. Now in this pic, as you can see, on the x-axis we have patients with no disease and patients with disease, and on the y-axis we have our test results. This line is known as the diagnostic threshold, which separates completely the positive and the negative people. So if the test is coming in low values, we means it has diagnosed the people with no disease, and if it comes in high value, then these people are having the disease. In the second pic, we see that if we decrease the diagnostic threshold, that is this line, if we decrease this value in the no disease population, if some individuals are getting in the disease area, that becomes false positive. Means they are not having the disease, but their test is coming positive, and in the disease people, all the individuals are diagnosed with the disease. So in this case, it increases the sensitivity of the test. Means it identifies the true positives, and this type of test is useful in the AIDS, in the diagnosis of AIDS. In the next pic, as you can see, if you increase the diagnostic threshold, then it can detect the false negative population. Means they are having the disease, but their test is coming negative. So in this case, it increases the specificity of the test, means identifying the true negatives. So for example, in cases of pancreatic cancer, this type of test is very useful. So I hope you got the concept of specificity and sensitivity. Now let's come to the positive predictive value, that is PPV. So it indicates the likelihood that a positive test result identifies someone with a disease. Means patient with a disease, and there is some test which, if it comes positive, then the patient is having the disease. So PPVP formula is true positive divided by true positive plus false positive. As you can see from this 2 by 2 table, PPV is equal to true positive divided by TP plus false positive. Means true positive divided by test positive individuals. Now the negative predictive value, it indicates likelihood that a negative test result identifies someone without a disease. So NPV is true negative divided by true negative plus false negative. As you can see in this box, that is NPV is equal to true negative divided by false negative plus true negative, equal to true negative divided by test negative people. Okay, so I hope PPV and NPV are clear to you. Now let's move on to prevalence. What is prevalence? Prevalence is the total number of existing cases in a population, which includes new cases and previous cases, and it is expressed as in percentage. Now what is incidence? Incidence is the number of new cases occurring within a period of time in the given area. It is a type of rate, and prevalence is a proportion. Therefore it is expressed in percentage, and incidence is a type of rate. And all of you know that prevalence is equal to incidence into duration. P is equal to I into D. Please remember this formula. Now our next is precision. So what is precision? Precision is the ability of the test to repeatedly obtain results that are close to each other. And what is accuracy? Accuracy is the closeness of the test results to the true value. Let's understand with the diagram. Now, for example, if the test values are coming in the center, all the test values are coming in the center, it means the test is precise, means it is giving the same value again and again, and it is also accurate because it is close to the true value of the test. Now in this case, the precision is good, but the accuracy is not good. Precision is good because the tests are close to each other, but the test results are deviated from the true value, so it is not accurate. And in this case, there is no precision and no accuracy because there is the test results are not close to each other and are far away from the true value. So I hope you guys are getting my videos and concepts of the lab medicine. I hope you should revise and watch the videos again to understand the topic. And please also watch my previous videos on hemat and chemistry. And that's enough for today. Thank you guys, and don't forget to like, share and subscribe my channel, and please also press the bell icon to get the notification for the upcoming videos.